To the physical medicine and rehabilitation scheduling video. The goal is to help you schedule physical therapy, occupational therapy, and speech therapy. PM&R scheduling is not difficult, it's just different. It's different and it's a slightly more complicated because normally physical medicine and rehabilitation scheduling requires 4 appointments, 1 eval, and 3 follow-ups unless otherwise stated. Plus there's also some manual scheduling which differs from our normal auto search. But once again, PM&R scheduling, it's not difficult, it's just different. So first, and probably most important with PM&R scheduling, is that there's pre-work. But it's really the same pre-work that you do for everything else. We're going to view the physician's order, and of course, we are going to paw. All right, so first, let's pull up our practice patient and begin the process. Go. All right. Of course, I'm going to look up my patient with 3,3 DOB, the North Shore Standard, 3,3 DOB. Okay, let me see if our patient is there. Miss Kitten is there, Patty Kitten. Of course, I would validate date of birth, street address, make sure I have accurate patient selection. Then I'm going to click Accept. Once the patient loads, of course, I always want to be better and check my header because the header does provide some valuable information about the patient. Provides the age, MRN, PCP on file, language, insurance last time here, and of course, North Shore Connect status. As always with hospital scheduling, I am then going to go to the appointment desk to view open orders. Let me just click here. Now what I want to do is look at open orders. I want to take a wink at my open orders link. So I click here and I see that the patient does have several orders in open orders. The one we're looking right now for is physical therapy. And we see that there is an order for physical therapy. It was placed on 11/12/2016 by the patient's PCP, Dr. Dooley, and the expiration date is 11/12/2017, and the priority is routine. Of course, I always want to open the order and check it out. The procedure tells me that this is physical therapy. As we will learn when we switch to PAW, there are different types of physical therapy. There's orthopedic, there's neurological, there's vestibular, there's perinatal. There are many types. So how do we know which type of physical therapy this patient actually needs? There are 2 things that will tell us the type of therapy the patient actually needs. One is the diagnosis. Cerebrovascular accident due to thrombosis of carotid artery. CVA is a key word, and we will use that later on PAW. The next really important thing that will help us determine what type of physical therapy the patient needs are the physician's comments. Please indicate the types. Evaluate and treat for left hemiparesis and ataxia. And once again, we see the term CVA. Okay. So these terms are key, CVA and hemiparesis. This will help us determine what type of physical therapy the patient actually needs. Of course, we're going to pay attention to the 7 things always on a physician's order. The procedure, our diagnosis, the ordering doctor, Dr. Nicole Dooley, the expiration date. We should always take a look at the priority. This is routine. Procedure category helps you determine the department that is physical therapy, and especially for physical therapy. But every time we view an order, we should be looking at comments. And the comments are especially helpful with all of the therapies because they will help us determine the right type of therapy to schedule. So this is part 1 of pre-work for scheduling PM&R. View the physician's order. This is always part 1. Part 2, and I could not imagine scheduling PM&R, physical therapy, occupational therapy, or speech therapy without going to PAW. So let's go to PAW now. Here is the Physical Medicine and Rehabilitation PAW page. We want to go to physical therapy because our patient's order said they needed physical therapy. So as we look here, you'll see that there are different types of physical therapy. There's aquatic therapy. As we keep scrolling down, there's neurotherapy, Parkinson's therapy. There's pelvic floor therapy. Probably one of the more common types of therapy is PT orthotherapy, orthopedic therapy, vestibular therapy. There are all different kinds of therapy. The next thing on your PAW chart, besides the type of therapies, are body part and restrictions. This will help you determine the type of therapy. Diagnosis. Remember, we saw in our patient's order the diagnosis was CVA. Eval. Normally, unless otherwise stated, a patient will have one eval. PAW will tell you how long the eval should be. And the patient will also have 3 follow-ups. Once again, PAW will tell you how long the follow-up should be. So in most cases, for physical therapy, occupational therapy, and speech therapy, we are scheduling 4 appointments initially. What this next column tells you is where patient access can schedule this particular type of therapy. For example, aquatic therapy, we can only schedule at the Evanston Athletic Center. However, if a patient was interested in the Glenview Park Center or Sky Fitness, we could warm transfer the phone call to their office for scheduling. All right. So now it's time to figure out what type of physical therapy does our patient need. If you remember, the key word in the diagnosis and actually in the comments was CVA, cerebrovascular accident. So, of course, F3 or Control F is always your best friend on a PAW page. So I am going to type in CVA. And if I click next, it drags me down here to neurological therapy. So as I read here, I see neurological therapy, lower extremities. The diagnosis that helped me indicate that it was neurological therapy is CVA, cerebrovascular accident. If you notice, you will also see another key word from the doctor's comments is mentioned here, hemiparesis, weakness on one side of the body. The eval is 60 minutes. There will be 3 corresponding follow-ups also at 60 minutes. And I can schedule these at either EMOB, Glenbrook, or Bannockburn. However, we do not have a referral site or other additional options for North Shore patients who need neurological physical therapy. So at this point, we've done our pre-work. We viewed the physician's order and we've gone to PAW to find out what type of physical therapy we're scheduling. The reason this is so critical is because all therapists do not do every type of therapy. For example, an orthopedic therapist would not perform neurological physical therapy and vice versa. A pelvic floor therapist might not do neurological physical therapy. So this is why scheduling the right type of therapy is so important, so that we bring up the right kind of therapist. So at this point, what we've done is our pre-work. We've viewed the physician's order and we've gone to PAW. Now it's time to start scheduling. Bring our patient back. So with Patty, we had looked at her order, Miss Kitten. We had looked at her orders and we had seen her physical therapy. We opened it up. We saw the diagnosis was cerebrovascular accident, CVA. We scrolled down. Of course, we made sure it wasn't expired. And we see that the two key words in the comments and in the diagnosis matched up with PAW, so we know that this patient needs neurological physical therapy. Just going to see if I can copy our diagnosis. Let's grab that. So at this point, what we can do is make the appointment. However, with physical therapy, occupational therapy, and speech therapy, there's really two parts to scheduling the appointment. There's what we like to call the setup. And the setup is super important so that you bring up the right therapist. Then what we'll have is the manual scheduling. And that's a little different from auto search. So remember, the scheduling piece involves two parts, the setup and the manual scheduling. So why don't we start the setup of the scheduling right now? As always, we'll put in our appointment notes. The order is in Epic, and I'm copying and pasting my diagnosis. Okay, great. Now I'm going to start with the department. Physical therapy, the department is PT. I just clicked in the department field, and now I'm going to hit delete on my keyboard. I'm going to type in PT and press enter on my keyboard. The patient wants to go to EMOB, Evanston Medical Office Building at 1000 Central Street. So we'll pick that location and click accept. Now it's time for the setup piece of the scheduling, because remember, we have to schedule 1 eval and 3 follow-ups. The visit type is super important because this will bring up the correct therapist, because remember, orthopedic therapists don't necessarily perform neurological physical therapy. Okay? So we're going to start with our eval. I click the glass just so that we could look through the visit types together. We'll scroll down. We see pelvic floor, breast, amputee, ankle foot. Here's one that just says evaluation. Now, this is for orthopedic therapy. Because it's the most common, they don't put in parentheses or indicate that it's orthopedic. But our patient doesn't need orthopedic therapy. Our patient needs physical therapy based on their cerebral vascular accident. So if we scroll down, we know our patient needs neurological physical therapy. So PT Neuro Eval is the correct visit type that will bring up the correct therapist. So we picked out PT Neuro Evaluation 10037. Now I click accept. Of course, I have to introduce the screening questions and ask the patient, Ms. Kitten, I just have a screening question to ask you to schedule your physical therapy appointments. Were you recently discharged from the rehab unit? Let's say that the patient indicates no. And of course, Ms. Kitten, the department may call you to review the details of your appointment. What is the best phone number to reach you at? Let's say she says the phone number that's here, so she confirms that, and we click accept. So we have entered the PT Neuro Evaluation visit type, and automatically all of the therapists have populated who perform PT Neuro Evals. However, if you notice, our patient wanted to go to EMOB, yet we have therapists for Glenbrook, we have therapists for Highland Park, many Bannockburn, many therapists came up. So what we want to actually do is, please forgive, we want to check ourselves before we wreck ourselves. But we want to make sure that all 3 of these boxes are checked right after we set up our eval, because we're on the setup piece of scheduling. So we're going to click Combine Departments, Auto Search, and Schedule At. All right, and that was checked automatically. Notice it's saying schedule at EMOB. So despite having therapists from all over, this will make sure that we only schedule with EMOB therapists. But always make sure that you have all 3 boxes are checked. So right now we've set up our evaluation, but this patient also needs 3 physical therapy neuro follow-ups. The good news is you only have to put in the follow-up 1 time. So what we're going to do is we're going to pick our follow-up visit type. Once again, the visit type is incredibly important. So let me click on our glass, and I'm going to scroll down. We want neuro because we want to make sure that we're selecting physical therapists who perform neurological physical therapy. And if we remember from PAW, their follow-ups were at 60 minutes for neuro. So we want PT Neuro follow-up 60 minutes. And something different is going to happen when we pick the follow-up than it did when we pick the eval. So we're going to pick this, we're going to click accept, and we just asked this, so the patient had already confirmed. We can click accept again. Notice when we select the follow-up, no therapists populate over here. But when we had selected the eval, too many therapists populated. So how do we get therapists for the follow-up? Right now, if you notice, the screen to the right says provider. And if we really just follow the directions below, Epic will tell us what to do for the follow-up. PT Neuro follow-up 60 minutes. Use the PT Neuro follow-up 60 minutes. Use the PT Neuro follow-up subgroup. So subgroup might be a new term for us, but this will help us bring up those therapists that perform neurological physical therapy. So if you look to the right, you see that there are 4 circles to select from. We don't want to provide a resource. We don't want a department search. We don't want a specialty. We want a subgroup for our follow-ups. So we're going to click subgroup. When you click subgroup, notice the word provider changed to subgroup. Now, if we click on the glass, we'll have choices of the subgroup that we should select. But Epic even tells us what to do. Use the PT Neuro follow-up subgroup. This is where sometimes people make a mistake. What they will do is they will pick PT follow-up EMOB. That will bring up orthopedic therapists. We have to bring up neurological physical therapists based on our patient's order. So what we really want, if we follow Epic, is we want the PT Neuro follow-up subgroup. Once again, please make sure that all 3 boxes are checked: combined departments, auto search, and schedule at EMOB. At this point, we have the setup piece done, and now we have to go to manual scheduling. Now, so what we're going to do is we are actually going to click auto search. This will save you a ton of time because now you will know when the first possible availability occurs. You will know when the first available appointment occurs, so it will save you from a lot of manual searching. However, although I am tempted, we cannot schedule via auto search. We have to go manual. The reason we have to go manual is so that we don't schedule into rehab eval only slots that are reserved for patients scheduling physical therapy via North Shore Connect. So you can auto search just to see when to start your manual search. And we're going to start our manual search on Monday, November 21st. But we're not going to schedule it. We are now going to go manual. So now, one of the first things that we learned in medical group front office training is always when you're manual searching is to remove the restrictions. The next thing is the plus sign always tells me if I have more providers to view. And I do because the plus sign is green. Once I click on it, in this case, it turned gray right away. So it brought up more providers. If you notice, you have 2 scroll bars. You have one that goes across, so I can see all of my providers. I keep my view on 3. The reason I only like to see 3 providers at a time is because I like to see this column. This column will let me know if anything is marked private. Watch what happens when I switch my view to 5. When I switch my view to 5, I can no longer see if anything is marked private. So let me go back to 3. Once again, you can scroll across. The first therapist, neurological physical therapist, is Janella Black. Then there's Denise Denholm, Karen Auerkamp, and let's see if I keep scrolling across. There's another therapist, Erin Mohip, but there's no schedule found for today. And today is Monday, November 21st. So now, what I want to do is bring up my calendar. The little number 17 here will bring up a calendar for you. The next thing is to pay attention down here. It will tell you the visit type that you are going to be scheduling, a PT neuro evaluation. This is what I want to schedule, and I want to start on Monday, November 21st. Let's say the patient is hoping for more of an afternoon appointment. They were actually hoping for 3 o'clock. Remember, you have the ability to scroll up and down, and it is important so that you can see some of these therapists actually have later evening hours, which might be more convenient for patients. So please remember up and down for times, and once you've clicked the green and there's no more providers, you can always scroll across to see all of your providers. All right. So let's say Denise has availability at 3 o'clock. If you remember some of the PM&R fundamentals of scheduling is that we could never start scheduling an appointment at 2:15 and we could never start one at 2:45. You always have to schedule PT appointments occupational therapy appointments and speech therapy appointments on the hour or on the half hour. The half hour or the hour. Never on any of the 15s, 45 and 15. So our patient was hoping for a 3 o'clock appointment on Monday, November 21st. And the first appointment we need to schedule is the evaluation. So the therapist can evaluate the patient and start putting together their physical therapy plan. Watch how easy this is. Since our patient wants a 3 o'clock slot, all I do is double click here. Now, if you notice, the slot turned blue from 3 until 4. Then what you see is that Epic put the appointment down here so that I can see it has actually been selected. November 21st, Denise Denholm. It's for a PT Neuro eval, and it's 3 o'clock, and the length is 60 minutes. So at this point, we do have our eval selected. Now we need 3 neurophysical therapy follow-ups. If you remember from physical therapy, occupational, and speech therapy, the goal is to keep the patient with the same therapist, in this case, Denise, for all 4 visits. That's optimal. There are other alternatives, but let's go with the best case scenario, that the patient will be able to see Denise for all 4 visits. Let's say now the patient changed her mind and that 3 o'clock was a bit late. She would really prefer a 2 p.m. appointment. All we have to do is right-click on the visit below and click Delete Row. Now what we do is we click on the 2 o'clock appointment. Just double-click on it and it will turn blue. And now the new appointment at 2 o'clock is showing here. So what we want to do now is schedule the next follow-up. Since we want all 4 appointments to be with Denise, if you click anywhere just once on Denise's template, you can switch now from all times multiple providers to all times single provider. This way you will be only looking at Denise's schedule for continuity of care. So let's do that. All I am doing is switching from all times multiple providers to all times single provider. Okay. So now we see Denise's schedule and only Denise's schedule, but right now I'm still on Monday the 21st, and that's when I scheduled the eval. As we know, we always have to give the patient a day of rest because whether it's physical therapy, occupational therapy, or speech therapy, it can be really exhausting for a patient. So they always need at least 1 day of rest between appointments, but no more than 10. Right? Let's see if there's any availability on the 23rd. Our patient would love to have an appointment on the 23rd. We do see that Denise is available on the 23rd, and the patient, once again, would like to keep her appointment times consistent, so she is asking for 2 p.m. Now we're on November 23rd, and the patient is requesting a 2 p.m. appointment. What is really important at this time, and another common pitfall is that sometimes schedulers forget to move the arrow, because if we did click right here at 2 o'clock, what we would have done in this case is we would have scheduled the patient for 2 evaluations. And we don't want 2 evaluations. We want 1 evaluation on the 21st and 3 corresponding follow-ups. So, as you recall, all we do is right-click on this and delete the row. Now what we have to make sure is that this arrow is underneath the follow-up visit type. So now we will be actually scheduling follow-ups. That's what we want now. We need the 3 follow-ups. So once again, if we just double click, the appointment slot will turn blue and we will see now we have scheduled our first follow-up, PT Neuro follow-up with Denise at 2 o'clock, and this is on November 23rd for 60 minutes. Once again, the patient needs that day of rest on the 24th, and it appears that Denise is out of the office on that day. So let's now try the 25th. The 25th, once again, the patient would like to come in at 2 p.m. Since Denise has availability on the 25th, all we do is double click, and now the patient's second follow-up with Denise has been selected. We have to make sure the patient has their day of rest on the 26th. The department is closed on the 27th, but let's check on the 28th. Once again, Denise is available at 2 in the afternoon, and that is on the 28th. So she's available on the 28th at 2. So our patient is very happy with that availability. So at this point, we have all 3 follow-ups scheduled for the patient and the 1 evaluation. If you ever have trouble scrolling up, because I want to see the evaluation, if you just move on this empty square, if I just click here and here, now I'll be able to move up here. So now I can see my PT Neuro evaluation on 11/21 with Denise at 2 o'clock. I can scroll a little further. I can see my first follow-up is on 11/23 with Denise, my PT Neuro follow-up, my first one. The second one is on 11/25, and the last one on 11/28. At this point, I can schedule. I have all 4 appointments on the appointment review screen. Of course, it is very important to always review all the appointment details with the patient. Make sure they know where they're going, where they have to arrive, if there's any preparation. And this call might take some time since you are scheduling 4 appointments and you're juggling the availability of the patient with the availability of the therapist. But remember, at patient access, the emphasis is always on quality, not quantity, and this call may take some time. So if we click accept, the ordering doctor in this case was Dr. Dooley. So in this case, we can type in PCP. We are always going to next until we can no longer next. We had, from the HIPAA question, the phone number best to contact the patient during the day. Of course, we could always ask for an email address and a mobile phone number. Now we click accept. And of course then, Schedule Reg Flow, tie it up in a bow, North Shore Connect, We would give the patient, we would schedule the patient, we would register the patient. As always, make sure that they have everything they need so their appointments are not delayed or that their appointments do not need to be rescheduled. Of course, also, is there anything else we can do? And thank you while trying to incorporate North Shore Connect. This has been your PM&R scheduling video. What I'd like you to do now is watch the video again, and this time try to schedule the appointments on your Patty patient along with the video. You will always have resources to help you with PM&R scheduling. There is a job aid on the Group C PAW page, and your specialist and department are always happy to help. Hopefully, this video will make you a PM&R scheduling star. Thank you.